Hello everyone. I would like today share with you some important point regarding the dental anesthesia because in the market today they say that we have a painless anesthesia and this is just for catching the patients, and I would like to share with you and discuss that painless anesthesia or less pain, which one is scientific. So let's to discuss and share with you important notes relating to dental anesthesia. The big question is that can the dental anesthesia have no pain 100%? Absolutely no. So we cannot say that we have painless anesthesia. We can say just we have less pain or comfortable one. So why this not happen? Why the patient still they experience a kind of pain? Because this is a question that we should have a scientific answer. Because if you go back to the techniques of dental anesthesia, we have about 8 techniques. So through all the techniques that we have, we should have a needle injection to the soft tissue or going through the soft tissue which is innervated with the nerves, sensory nerves, and then to the bone, inside the bone in the intraosseous technique, that they have a periosteum which is a very sensitive layer and innervated. So regarding this point, we know that we should have pain at the site of injection. So how to make this pain comfortable or less pain, but it's not painless. Be sure about that. So as you see, even with the technique that we have, we should inject the needle to the soft tissue. You may say that I have this device, which is a very advanced and expensive, but even this device, they have a needle, they should go to the soft tissue or periodontal ligament, which is also innervated. So the patient still, they experience the pain. But how to make this pain comfortable or less pain? So let's go to the first important point, which is explanation for the patient, which is very, very important, because when the patient, they see this long needle, which is from 6 millimeter to 30 millimeters, they should go to inside the bone. This is the imagination of the patients. Absolutely, they get fear from that. So it's very important to explain for them that this needle is designed for different techniques. So we just need, for example, for the infiltration, about 2 millimeters or 3 millimeters as much as possible, maybe as we have a thickness of the gingiva. So very important, this explanation. The second point is that we should apply effective topical anesthesia. And you say that I use a xylocaine spray, and this is not good because the xylocaine is not constricted to the selected area. So gel or cream is effective for that. So please use the gel with a Q-tip, very small amount to the dried area and firmly to the area, and wait from 2 to 5 minutes to get anesthetize the soft tissue in order to prevent the field of injection of the needle. The third point is that we should choose a small size needle as much as possible. And in the market now we have a gauge 31, which is very nice. 30 is standard, but please don't use gauge 27. The fourth point is to make a warming for the anesthetic solution, either by this device, which is designed for composite heating, or by our hands, because the anesthetic, which is warm, they will make a vasodilation and less pain and more distribution, while the cold one make vasoconstriction and pain and pressure on the nerve. So the question is that when we put every day this in device, does it make it expired? No, because whenever you have 2 patients or 3, just put about 3 carpules. Then before you finish the last one, put in another one. But if it's still inside this device for every day, absolutely it will affect the anesthetic solution. The 5th point is that whenever we have a visual exposure of the needle, the patient remember all the bad experience about the dental anesthetic pain. So please don't make a visual anesthesia. This is an important point, another important point to explain for you, that we have this kind of needle that designed for high pressure for the intraligamental. This is from history. Please don't use it now, because whenever we have a high pressure, mostly the carpal will get broken. But this device is, or anesthetic syringe is designed that all around the anesthetic solution glass, they have a metal, so it will not get fractured or destroyed. So, but it's useless, please, because they have a high pressure, short pulses, and this make pain for the patient. So this is just to show you how it's loaded, but please don't use it, because I used only for a few times at the beginning, and when I see this high pressure, I know that it is not good. The new device, which is electric one, so there is different company, different devices. The idea of this device or this technique is that they have a control for the flow and the control for the pressure. So it depends on your technique. The device has the mode. So we have the fast mode, slow mode, PD mode. So it's a very nice device, because they will control the flow and the pressure, and you can choose the technique that you need. Please don't say to the patient that I have electric one and you feel no pain. This is not scientific, as I mentioned before. So you can use the device that you have in your clinic. Just you should be sure about that the device is working well. They have a control flowing and control pressure. The 6 point for the comfortable anesthesia is to choose the directing of the dot on the needle toward the bone. Some company like this green one at the right side, they have no dot, and the dot is, as you see, at the side of the bevel. So if the needle have no dot, please direct the bevel on the needle to the side of the bone. And the 7 point is that it's very important to make a continuous slowly flow of anesthetic to the site of injection, because you may say I have no electric device, so you can do that with your traditional syringe. Just look to the drop, but continuously, slowly at the site of injection. So if you have an electric device, you should check that the device before you do it. It should be like this, very slow drop to the site of injection, and it's very important to start before you inject the needle to the site of injection. You see in the video, so the anesthetic solution start to deliver, and then we inject the needle at the site. So let's go to the very important technique, which is periodontal ligament. We make as I said before, effective topical anesthetic solution at the site of injection. And here I am choosing the traditional needle or syringe, sorry, but you should be patient. Very slowly, you need at least about 1 minute and a half, sometime more than 2 minutes. At the beginning, you feel nothing, but then you slowly, you see the blanching at the site of the injection. And as my experience in my clinic, some patients say that even my anterior teeth get pain, get anesthetized, and this means that the solution will go until the inferior alveolar nerve, and we should give for both roots, mesial and distal. And remember, this technique is not control the pain 100%. The original will not control 100%. And by the way, the lower dental anesthesia is one of the anesthesia that globally they say that we have no profound anesthesia for every cases. So you can get benefit from this technique. So you can do single technique anesthesia for the single tooth anesthesia by this way. I hope you get benefit from this video. Thank you very much.